All right, good morning. This is Manuel Torres with NOLA.com, the Times-Picayune. I'm here with reporter Jed Lipinski, who covers healthcare and other issues for NOLA.com. We're going to talk about cracking the code, the real cost of healthcare. This series we're working with Fox 8 News and Lee Zurich. We had a few stories a couple of months ago when we told you we were collecting prices for healthcare across the metro area, and now Jed and Lee have started presenting the results of that work. A couple of stories are on our website. If you go to NOLA.com or to fox8live.com, you'll see them there. We're going to talk today about some of those stories and some of the heartbreaking examples that they have found in their research about the obscure prices of healthcare in our area and how that hurts some of our viewers and readers. So, Jed, welcome. Why don't we talk a little bit about Mitch Brandon? Tell us who he is and how he came to be a part of the series and what he represents.
Sure. Mitch Brandon is a former counterintelligence agent with the U.S. Army, and as a result of our series, he contacted us and Fox 8 with a story about an MRI that he received after injuring his neck while lifting weights. He went to the VA hospital where he's covered by something called the Veterans Choice Program. The VA directed him to Lakeview Regional Medical Center where he received 2 MRIs, and unbeknownst to him, he was supposed to get 1, he received 2, and 6 months later he got a bill for collectively $8,066.
So $4,000 per MRI.
$4,000 per MRI. He'd not been told.
Is that the normal price?
No, it's not. He hadn't been told about the price beforehand, but he was shocked to receive this bill. And as it turns out from our reporting, Lakeview Regional charges something like $650 and $450 respectively in cash for both of those MRIs. So had he known that the cash price was much, much less than what he eventually paid, he would have saved a lot of money.
So let's make the distinction clear, because I think this is the one key finding you guys are discovering, and in this series we're doing in partner with Clear Health Costs, a New York-based journalism initiative to make these prices transparent. So what you are finding is that hospitals or providers have this so-called cash price. Basically, if I show up and say I don't have insurance, how much will it cost me to get this MRI? He will have been told $400 or $600, depending on the type of MRI he was going to have, whereabouts. But because he went through this program, or if I go through my insurance company, or simply most people who ask, they are not told, and they don't know what the price is, this cash price is in advance. Is that right?
Exactly, yeah. Due to the lack of transparency on the part of a lot of insurance companies and providers, patients just don't know what they're expected to pay beforehand. And many people just don't know to ask. They wait for their explanation of benefits form to come to them in the mail, which happens a couple months later after they've almost forgotten that they got this procedure, and they're shocked to find the cost is exorbitantly high. Had they known to ask for the cash price, however, again, they could have saved a huge amount of money. The problem is a lot of hospitals, especially in the New Orleans metro area, do not provide those cash prices, or don't make it visible, don't make it easy to find those cash prices. That's what this project is an attempt to do, to elicit those cash prices from hospitals in the area, so that people know or have a resource to figure out what they could potentially pay and how much they could save if they decided to pay cash, rather than go through their insurance.
And you mentioned the explanation of benefits, which is if you have insurance, that's the document you get in the mail generally, or you can get it from the website of your insurance company, that tells you, supposedly, it tells you what you had done, how much of that money or that charge I have to pay for my copay or co-insurance, and how much the insurance company is picking up, right?
Exactly.
But are they really explanation of benefits? Do they live up to the name in Louisiana?
Yeah, that's the question. In many cases, an explanation of benefits does not explain what your benefits are at all. In fact, they don't include the information that you really need as a patient. So we looked at the different health providers in the state, the 5 top health providers. Blue Cross Blue Shield, according to the Department of Insurance in the state, is the biggest provider. It covers something like 490,000 people in Louisiana. In their explanation of benefits forms, they do not provide the name of the procedure that patients received or the 5-digit code that accompanies that procedure, and that is the basis for pricing for each of these procedures. That's crucial information. If you had a procedure at the hospital, you want to know in your so-called explanation of benefits what procedure was done. For example, if you had a colonoscopy and you were mischarged for something else, on a Blue Cross Blue Shield of Louisiana EOB form, you would not know.
Because what I see is just the list of the provider, but not what the service was.
Yeah, what's provided on the Blue Cross Blue Shield EOBs is, the name of the provider, sometimes the doctor, him or herself, sometimes just a term like miscellaneous services, or the lab where a blood test was performed, which is not helpful at all.
How does that compare with a company or a health insurance that does provide the information that helps people see what it is that they're being charged for?
Exactly. So Aetna in Louisiana and around the country provides detailed descriptions of the procedure and the procedure code, and that really helps people understand if a billing error occurred. They started doing that, according to their spokesperson, in 2010-2011 to correspond with the Affordable Care Act's mandate that certain states provide that information. Certain insurers in different states provide that information in their EOBs to just help people understand what they're being charged for, what they're being billed for.
Okay.
So United Healthcare also does not provide that basic information in their EOBs, and when we asked them why they did not, we were told that that was for the privacy of the patient.
Well, hold on. So United Healthcare, if I'm a United Healthcare insured person, I'm the patient, what I get directed to me doesn't tell me what I had done to protect my privacy?
Yeah, exactly.
Is that for real?
Yeah, it is, but it doesn't make any sense.
Absolutely not.
It doesn't. As one of our subjects said, one of our healthcare experts said, that just simply doesn't make any sense.
Right.
What right does Aetna have to deny me information about my medical care? They're my insurance.
Or United in this
United,
case.
I'm
Right.
sorry. They're my insurance provider. They're the ones that should be providing that information to me, and yet they're withholding that information. And their explanation for why they do that is, it's privacy, and if you just contact our customer service reps, you'll get the information you need. But as everybody knows, you're going to get put on hold. That's going to take 20 minutes, and then you're going to get disconnected, and you're going to be extremely frustrated.
So a quick question. Christine Melanson in the comments of this video, and thank you, Christine, for watching, and all of you watching. She said this is not a problem just in New Orleans, it's in other places, and that is correct. You mentioned the Affordable Care Act. Some of our readers in the comments of the stories that you guys have posted so far are raising the question, are the changes, there are changes in the works. The Republican House is, in fact, today, probably voting on some changes to the ACA.
Right.
Does that affect this, or is this a totally different thing than the ACA?
This is separate in that, for example, Blue Cross Blue Shield is a state-by-state insurance company. So the EOBs through Blue Cross Blue Shield of Louisiana are going to look different than the EOBs for Blue Cross Blue Shield of Louisiana. So it kind of differs.
Let's say,
of Alabama, yes, I'm sorry. So it differs state by state.
Gotcha.
Yeah.
So some Blue Cross Blue Shield customers in other states do get that nice real explanation of benefits.
They do.
We just don't get it here in Louisiana because,
It's true.
I believe Blue Cross Blue Shield indicated they might be changing that. Is that right?
Yeah, they are. And that's what they told us. When we said, why don't you provide this information that patients deserve, they say, well, as a matter of fact, by the end of 2017, we plan to provide that information to be more upfront with our members. And that was based on data collection that they did and patient surveys, and naturally people wanted that information, so they're going to provide it. Okay.
One thing to remind you all out there who are watching and reading this important series, we have on the websites at NOLA.com/health and at fox8live.com/health the price tool that Jed is talking about. What that is you can go in there. We Clear Health Cost, our partners in this effort, survey for multiple weeks, multiple providers for a range of services in Metro New Orleans, and they have the prices that were given by those providers. You also can use your explanation of benefits, your charts that you get from your insurance company, or the information you get on your website. We have an explanation of how to do this, how to you yourself enter the pricing data that you have from the bills that you receive or the explanation of benefits you receive, so you can grow and help grow this database of cash prices and prices that hospitals and clinics across Metro New Orleans are offering. So we really want you to submit all your prices. Right now we're particularly interested in colonoscopies. Can you tell us why it is that colonoscopies is in your research rising as a topic to look further?
Sure, yeah, we have a story specifically planned on colonoscopies in the near future, and one problem that we've discovered through our research is that colonoscopies are often miscoded, and in some cases on EOBs that do list the name of the procedure, they're mislabeled.
What do you mean by miscode? Like I had a colonoscopy done, but what I get in my EOB or in my bill is something else?
Exactly. Someone can have a colonoscopy screening done, and under the Affordable Care Act, colonoscopy screenings are considered preventive procedures,
okay.
So therefore they are covered under the Affordable Care Act. However, diagnostic colonoscopies, which are performed if someone has received a diagnosis of cancer, for example, are not covered because they're not considered preventive. So many insurance companies will not cover the entire cost of a diagnostic colonoscopy. However, in your EOB, if you just see colonoscopy, you're not going to know whether you received
which one it was,
a diagnostic or a screening.
And one is more expensive than the other one.
Essentially, yeah. Often, I think diagnostic colonoscopies can be more pricey, in addition to not being covered by a lot of health insurers.
Right,
yeah.
Right. One final thing, so we know we're going to have a story that you and Lee are working on about colonoscopies coming up in the over the next few weeks and then months to doing some more reporting. What else is on the hopper? Tell us about tonight. What you guys are working on for tonight?
Yeah, we have a story tonight about the people, the insurance companies, or I'm sorry, the providers in the area that did or did not respond to our requests for cash price data. At the beginning of this process in February, our partner Clear Health Costs made a number of calls, dozens, hundreds of calls maybe, to hospitals in the area, clinics requesting cash price information. What does this procedure, what does a colonoscopy at your clinic, at your hospital, cost for people who do not have insurance in cash? A number of hospitals complied with that request and provided us with cash prices, but many hospitals, including some of the biggest in the city, did not. Last month, we went back to those hospitals and requested the information again, this time contacting spokespeople for the hospitals. And in response to that second follow-up request, we did receive a number of cash prices from some.
But others are still not.
Yeah, for example, LCMC Health, which owns a number of hospitals in the city, including Children's Hospital, UMC, West Jefferson, did provide those cash prices.
And we'll have more details on that tonight. But
we will.
Right.
Yep.
So that's tonight at 10 p.m. The broadcast, Lee Zurich will have that report on WVUE Channel 8. And then we'll have a story on NOLA.com. In the meantime, you can find the existing reports that Lee and Jed have been working on. They're again at NOLA.com/health or fox8live.com/health. This is Jed Lipinski and Manuel Torres from NOLA.com, the Times-Picayune, and we'll see you around next time.
Thanks.
Thank you.